Uh,
Please go ahead.
I am a board review professor for one of the Caribbean medical schools as well. And well, I must apologize for joining in very late. I have had quite some hospital emergencies. But
Okay.
um, from your presentation, what I have gathered is, well, one, students can be assigned cases and they can discuss in group forms um, on each of those cases or individually, right?
Right.
Now, in the context of the current times, especially with the COVID-19 pandemic going on, if they return to clinical practice at their respective hospitals, is there a way for them to continue with the discussion of the cases um, on Aquifer in terms of coordinating such discussions within the context of the classes?
So I think that I understand your question. That well, maybe I don't. I'm going to reframe. So they're using the cases now, and so if they complete the cases and they understand the diagnoses, then I think that that would be a way to coordinate with preceptors going forward. And so that's one way to do it, or you can link it to their classes that they're taking. Is your question having to do with continued access to the cases after June 30th?
Yes, that's one part of the question. But the second part is, as a group, will they be able to, well, considering the different rotations that they may that they may be undergoing, will they be able to coordinate that when the current pandemic is over?
Um, I think that I'm not sure that I can answer that question to the way that you would like. I don't know, Kate. Do you want to give it a shot?
So the question, I think, is about continued access, and all the schools that have special COVID access should have received their single point of contact, should have received a subscription continuation letter with options. So the programs that want to continue after July 1 will need to make a decision about what courses they want and all that. So if you're on this call and you haven't received one, you should send an email to subscriptions@aquifer.org and we'll do follow-up. So I think that's the first part of the question. That's the most important thing. Aquifer is very generously offering grants to assist programs that have had free access that would like to continue after July 1. So that should be said. But if you don't continue if you don't decide to elect a package after July 1, access will end on June 30th.
Right. And I think that thank you, Kate. And I think the other part of this is if you do continue, then it's seamless for your students. So that information, and maybe that's the other embedded thing, their information, what they've done in the cases all continue. So they don't have to start all over again. And that they would be able to link it to different rotations. So if they're in taking care of adult patients in internal medicine, they'll be able to see that. So I hope that answered your question. I'm just looking at the time and want to make sure that we give everyone a chance to ask their questions and we can attempt to answer them. Shihab El Hashimi.
Hello.
Hello.
Dr. Shihab El Hashimi. I'm the Dean of National University of Natural Medicine Naturopathic Program. Okay. And our scope in Oregon is similar to medicine. We follow a similar trajectory, although it's a bit accelerated. We have your access. We've shared it with our faculty. It's addressing a lot of our needs, but we haven't really implemented it. So you've actually answered a lot of my questions and how to incentivize students to do a lot of that stuff. We've put on most of our energy into telemedicine right now, and this will actually ensure that we have a well-rounded kind of experience. So I'm listening and learning. Thank you so much.
Perfect. And I will say for your specific content, I think you have an option. We've worked with our osteopathic colleagues around this sort of a model, is to think about the cases and are there principles in naturopathic medicine that you would like to blend in. So that would be a great way to use your cases, that you assign some cases and then you can bring the elements that are unique to your training program into a discussion with the students. So it's just something else to think about, since that content is not in the cases, how to make these real for your students, and that they can apply the things that they've learned in other settings.
Yeah, that's awesome. I look forward to network with osteopathic if I could. Thank you.
Great. Dee Saunders.
Good morning. I am the Associate Dean of Graduate Medical Education at the National University of Natural Medicine with Shihab. And I am listening in to see how it could fit or accentuate the Graduate Medical Education program, and which is a residency program for naturopathic doctors, not only within our institution, but also nationally in several other states. And a lot of my questions also have been answered. Understanding the learner level was one of them, and then trying to extrapolate out how to make this beneficial at the graduate medical education level. So thank you for that. Yeah, and I'm just listening and learning in as well, and I don't have any other additional questions.
Perfect. So, the fact that you're at GME, I think that a couple, just taking from some of the things that others have done with more advanced learners, really using these as just prototypic patients to get to sort of as a conversation starter. I think linking to guidelines, linking to, again, how would you apply some of your naturopathic principles. All of that works if you just think of these as virtual standardized patients and prototypic patients. I'm not sure if the GME learners also work with undergrad, but using this as a resident as teacher is something else that some of our programs have done, and that it's then back on the residents to actually teach the undergrads principles using these cases as a starting plot. So that's something that you might think about if that works within your, in the context of how your programs are set up.
Yes, thank you for that. And it actually does fit neatly in right now where our residents are creating their own cases and taking them to the undergrad, facilitating the same process with them. This would certainly ease the process of creating modules on their end to do this for student learners, so undergrad learners. So thank you.
Yeah, perfect. And then last, I think, is Donna Chambers.
Hello, Dr. Smith. I'm Donna Chambers. I'm from Kennesaw State University in Kennesaw, Georgia. And I work with the nurse practitioner program. And I just wanted to find more information out about this program, because right now we were using it as simulated hours because of the COVID-19. A lot of the students weren't able to finish their clinical hours, and also having a difficult time right now trying to get their pediatric hours. I heard one student saying that they really enjoyed it. It was more realistic compared to some of the other platforms, but I just wanted to know more, know a little bit more about it. You answered several questions. One thing I did like was the oral presentation, because I think a lot of students had a hard time learning how to present a patient. So I did like that, but everything I've heard so far I really like, so thank you so much.
You're very welcome. And, I told you pediatrics is, of course, I'm a pediatrician, and in the student resources, there's an interactive table about pediatric milestones. And so even thinking about assigning that for them, having go through, see if they can identify what's normal and name it, I think it's a great example for them. And I've talked to several programs for nurse practitioners and PAs and fourth year medical students, and the idea of practicing oral case presentations, calling a consult, I think is another way to frame that practice based on the case. So thank you.
Thank you.
So So I think that, Leslie, do you have anything else to add? Dr. Fall is with us. She's the CEO of Aquifer. I think that we've run through everybody's questions, and happy to have your own thoughts about how to use Aquifer cases as well.
Yeah, thank you, Sherilyn. Hello, everybody, and thank you very much for coming to the webinar and for sharing really who you are and what you're doing. It's fascinating. I decided to join this group because this group seemed the most fascinating. So I love hearing what everybody is doing. I think the point that Sherilyn just made about pediatrics again, I think because we started in pediatrics, I'm a pediatrician by training too, that I will have to say, I think we've had the most developed additional content for those cases that's available. That is available to the students and the student learning resources, the child development module, the oral case presentation case as well, should your learners continue as learner-only access. And then we have some additional classroom material and other teaching material, as Kate mentioned and Leah mentioned, if you decide to move to an institutional subscription for your learners. The other is, I actually am also a past GME director, residency program director. And I think the other thing that was not mentioned today, but has been very beneficial, I think, for many of our residency programs, is potentially also using it for either remediation, and remediation either because you do have a struggling learner and or you have a learner who just has not had sufficient background in an area as a resident or a trainee to really kind of get caught up to speed to where they need to go. So oftentimes too, our residency programs are finding that they really do provide some sort of background, kind of covering the waterfront for learners in the background in a way that one would expect that a student heading into a residency program or GME program really had attained already. And so that was always a really nice feature as well for us as residency directors, is to make sure that they did that. And then last, I will really also reinforce the idea of using these with your residents as kind of residence teacher, because it may be that your schools are considering using this for your undergraduate learners. And then if you do have graduate faculty or graduate medical student or residents, teaching them, leveraging these is kind of a nice structured teaching methodology, kind of helping them to think about how one would teach clinical reasoning through a case, very typical case for a learner. Really, I think in many ways kind of enables them to jump to that residence teacher level relatively quickly as well. I will also validate the oral case presentation case has actually been studied, and it is as effective as teaching learners to present cases in person. So one of our colleagues at, I think Harvard, right, Sherilyn, Boston University, did a study in which he had a course in which faculty were teaching students how to present a case, and then they had an objective assessment on how they did, and then they double-blinded it with students doing the online oral case presentation case, and the students did just as well as those students who had learned from faculty. So again, it's another nice way to do it in a relatively cost-effective manner and ensuring that everybody sort of kind of gets the same education as well.
And that, thank you, Leslie, that's really important. And that case, the oral case presentation, is one of our free courses. So that's the students that they have, that's available to them. So if you can just send them the way, and it's a wonderful module going through and figuring out like what's important to say, so you don't get the person who gives you everything, and really helping you prioritize. So it's a great refresher for people, as well as training people for the first time.
And Sherilyn, one quick sec too. The other thing to think about as well is, thank you for reminding me this as well, is, so as Sherilyn said, the oral case presentation case is in fact one of the free cases that, so when students subscribe or programs subscribe, we actually have this nice little panoply of grant-based free courses that are available. So in addition to the oral case presentation case, there are also free courses in high value care and in culture and health medical home. And so and diagnostic excellence, teaching students how not to make diagnostic errors, cognitive diagnostic errors. And so it's kind of a nice add-on to the subscriptions, both individual and institutional, that there's actually kind of rounds out your curriculum a bit more too, and gives you more opportunities to talk to learners about, high value care practice, culture, medical home, and diagnostic error. And I think sometimes in this age of COVID, people are also looking for some nice extended curricular material. And those are well written, also maintains consistent with the rest of our courses. And oftentimes people find them to kind of be a nice extra thing.
Great. So I think that we have about 50 seconds before we go back to the large group. I just want to end here by, thank you all for taking the time to come and ask your questions. I hope that we tried to answer the questions that you had. So if, and feel free to reach out if other things come to mind that you would like clarification on.
Thank
So
you.
you guys can, you're welcome. So you can click to